Okay, this is the third part of our discussion about bacteria. So we are finished with gram positives. Now we move forward to our gram negative cocci. So again, gram negatives appear pink due to safranin. They did not the crystal violet stain did not adhere because of the cell wall of the cell wall composition of our gram-negative bacteria. Meron siya lipopolysaccharide na resist sa staining. So the first one in our gram-negative, we have our Neisseria. It is known as kidney bean shape or coffee bean shape. We have two Neisserias, we have meningitis, and we have gonorrhea. So its mechanism of infection inhibiting the mucous membrane of mammals, and it is positive for oxidation reaction test. Test for Neisseria is oxidase reaction test. And gonorrhea and meningitis. So here we have Neisseria meningitis is nervous and irritable. As you can see here, two friends are eating in a balcony, having their breakfast. Kakurog sa Neisseria. It is nervous and irritable because it causes or it infects the nervous system, irritates the nervous tissues. So while Neisseria gonorrhea is a pervert, as you can see, this one may ginakaptan siya yung poster with a naked woman in it. So, Neisseria gonorrhea is a pervert because it is a disease that is transmitted through sexual contact. And Neisseria gonorrhea infect the reproductive organs. So that's why. Again, meningitis is nervous and irritable. I hope you remember this. It infects our nervous system. And then gonorrhea is a pervert because it infects the reproductive system. So let's go with meningitis. Meningitis causes meningococcemia and meningitis. Meningococcemia or sepsis as we call it produces acid from glucose and maltose in carbohydrate acidification test, and the portal of entry is nasopharynx. So symptoms, let's focus our attention here at the bottom. Pale or mottled skin, unusually cold hands and feet, breathing fast and breathless, limb joint and muscle pain. So for meningitis naman niya, sensitivity to bright light, seizure, severe headache, and stiff neck. So in meningitis, I've also seen this in a medical drama, House MD, patient with meningitis, may ara siya, sensitivity to bright light. So may seizure siya pag may bright light. Also, guys, the sensitivity to bright light can also be observed with those with patient with cold. So, mas sensitive kita sa bright light kung natrangkaso kita. But it doesn't have any accompanying disease or accompanying complication with that of colds. In meningitis, may seizure siya since sa brain ang aton infection. Meningitis, itis, guys, meninges, inflammation of the meninges. The meninges are acutely inflamed with thrombosis of blood vessels. This is the normal brain. Advanced bacterial meningitis. Diba sa inyong experiment, ang patient to may meningitis. And the diagnosis for it is the lumbar puncture. Gina-obtain ang CSF. Treatment is penicillin G or ceftriaxone. At the first indication, prevention of meningitis is rifampicin, and right now there is no vaccine available for our neonatal meningitis. Next one, we have gonorrhea. Disease is gonorrhea, known as the clap or the drip. The clap, kaysang una ko no, during the time, gonorrhea is, symptoms is burning, itching, or pain. This is more common in male. So, sa una daw, ginaklap nila kay sakit kung mangihi sila and tulo, di ba? Gonorrhea is known as tulo or the drip. May discharge nga gatulo. Kag sakit siya, so ginaklap na siya kuno sang mga person infected with gonorrhea during the old times. So in men, we have penile discharge, and there's painful and burning urination and swelling of the testicles. For women naman, vaginal discharge, same month, and may bleeding between periods. This is more dangerous with women because hindi siya makita gid eh. Vaginal discharge is common with women, especially kung managabot ang tiyan, di ba? We have discharges, but the thing is, if infection siya, of course, yellow na siya. Usually, pus na ang gagwa. But here, bleeding between periods is hard to distinguish since it's period. What did you do when you have your menstruation? Diba, menstruation, there is shedding of the endometrial lining in our uterus. Pag may shedding, blood na siya. Ang tissues, kung magwa siya sa body, is in the form of blood. And how would you know that it is the bleeding caused by the gonorrhea or it's the bleeding caused by the endometrium? So that's hard for women, but it is most common in men, the gonorrhea in men. So possible complication, we have epididymitis, inflammation of the epididymis, prostatitis, prostate gland, and urethral strictures. Treatment of gonorrhea is ceftriaxone. Please remember this, treatment of gonorrhea is ceftriaxone. So this is what happens in women. It can progress to pelvic inflammatory disease or PID, known as pus in deer. Causes endometriitis, inflammation of the endometrium, salpingitis, inflammation of the fallopian tube, and oophoritis, inflammation of the ovary. The true gonorrheal vaginitis happens in pregnant and menopausal women, and in girls who have very loose epithelium and does not contain glycogen. Complaints are profuse discharge, itching, and burning in the vulva. Sometimes granular eruption can be identified with the help of palpation. So may ara nga, inflammation na. This is endometriitis, inflammation of the endometrial lining or the endometrium. We have our salpingitis, inflammation of the fallopian tube. Here gali. Fallopian tube, aritan fallopian tube. May nag-inflame siya, ara na da ang atan nga gonorrhea, and we have our oopharyngitis, inflammation of the ovary. As well, accompanied with, of course, inflammation of the fallopian tube. Complications of PID, pelvic inflammatory disease, we have sterility, hindi na siya kabata, unable to fertilize an egg, ectopic pregnancy, abscesses, peritonitis, and perihepatitis, known as Fitzhugh-Curtis syndrome. Perihepatitis, Fitzhugh-Curtis syndrome. Then, this gonorrhea can be transmitted in neonates. For those mothers or those mothers infected with gonorrhea, pwede na siya mapasa sa bata. Also known as ophthalma neonatorum. Please remember this and the information I have provided here. Treatment is erythromycin eye drops, and the prevention, ang mga bata ginapatuluan sang silver nitrate caustic solution. This is done in hospitals and right now commonly practiced pa siya. Silver nitrate caustic solution and erythromycin eye drops. So ophthalmia neonatorum, gonorrhea in infants, ginagaan, prevention, silver nitrate caustic solution. Treatment of gonorrhea, ceftriaxone, and if the patient is allergic to cephalosporins, we can give spectinomycin or ciprofloxacin. Next, we have our gram-negative bacilli. For the gram-negative cocci, we have Neisseria meningitis and Neisseria gonorrhea. For gram-negative bacilli, we have the enterics, or the ones that infect our gastrointestinal tract, or the intestine. They are part of the normal flora of the intestine, causing gastrointestinal disease. Infection is through fecal-oral route. What does it mean? Fecal-oral route. From feces, gina-carry na siya sang aton carrier or aton vector pakadto sa food, ma-ingest ang food, magwa na naman sa feces ang bacteria. So, common symptom is diarrhea. Pag usual, guys, pag fecal-oral route, as I've observed, pag fecal-oral route, ang entry, portal of entry, ang common na nga symptom niya is diarrhea. Nausea, vomiting, and diarrhea. So here we have our the factors. So we have O, K, and H. Antigenic classification of enterics. The O antigen stands for outer because it is the most external component of the LPS. K antigen capsule kay gina-cover niya ang O antigen. And H antigen, remember, flagella. Only bacteria that are motile because it has flagella. Flagella is a structure for motility of the bacteria. And the escape of gram-negative kaginaya. Last week, we've discussed the escape that causes nosocomial infection. Now, this is the escape in the gram-negative naman niya, gram-negative organism. And it is also has the escape pneumonic. Of course, E. coli is present. Klebsiella pneumoniae is present. We have now the Achycerachia. We have the Proteus mirabilis. Pseudomonas aeruginosa is also present. It is also the one that causes our nosocomial infection. And then we have our Enterobacter. So this is the escape of gram-negative. The most common is the escape pathogen that causes nosocomial infection. This one, it does not all of this, hindi magitanan nagka-cause na nosocomial infection, but this is an escape of gram-negative. Common characteristics of gram-negative: motile with peritrichous flagella or non-motile. They grow on peptone or meat extract and grow also in McConkey agar. They are facultative anaerobes. They ferment glucose, often with gas production, and catalase positive, oxidase negative, and they reduce nitrate to nitrite. These are the common characteristics of our gram-negative bacteria. So, presumptive identification, please read through lang, dali natin. I want you to remember the lactose fermenters and the non-lactose fermenters. So, these are lactose fermenters still, pero slow siya. This one is rapid. Lactose fermenters, si E. coli, si Enterobacter aerogenes and Cloaceae, and also Klebsiella pneumonia, and Edwardsia laceratia, Citrobacter, Arizona providentia, and Erwinia. So these are the medically important species that we will be discussing: is Escherichia, Shigella, Salmonella, Enterobacter, Klebsiella, Serratia, and Proteus. So E. coli, the Escherichia coli, known as E. coli, it is positive for indole, lysine decarboxylase, and mannitol fermentation and produces gas from glucose. It hemolyzes blood agar via urine isolation. So this is what our E. coli looks like. It has flagella all over its body. That's why it is known as peritrichous. Pathogenesis. What are the diseases caused by our E. coli? First one is UTI, or the urinary tract infection, and then the most common and the most popular cause of the disease of our E. coli are these ones, or are these five. We have the epic, etic, estic, aic, and aic. And then we have the less popular, the sepsis and the meningitis. So first, let's move forward to the UTI. UTI, urinary tract infection. Basically, the E. coli bacteria found in the urine, nagnaog siya sa urinary tract. White blood cells comes out in the urine to fight the bacteria, and that causes the infection. So pag may infection, guys, may increase in white blood cell. That's how you know if there is an infection in the body. Like sa urinalysis or sa blood works, taas ang WBC. That means may infection. So the limited to bladder and lower part of the urinary tract. So sa bladder siya kay sa lower parts ng aton nga urinary tract, causing lower urinary tract infection. Pag sa kidneys siya, causing pyelonephritis, and pag enter siya sa circulation, it's sepsis. E. coli, guys, is part of the normal flora of the body. So, pag magnaog siya sa urine or sa urinary tract, that's when it becomes pathogenic. Symptoms, we have burning pain known as dysuria and bloody urine known as hematuria, may frequent urination, pressure in lower pelvis, strong or foul smelling urine. We have also night sweats, shaking or chills, and of course the low-grade fever. Pag may infection, may ara ginaya fever. Risk factors are female, of course, female are risk factors since the anus is near to the vagina. That's one of the reasons why we are a risk factor for that. That's why proper hygiene must be observed. Then those that are using birth control. For male, we have catheter use. Of course, harbor ang bacteria. And of course, those immunocompromised patients are very, very susceptible to UTI and menopausal women. So diagnosis, ultrasound, cytoscopy, and CT scan. But in the practice, as what I have observed in the areas I am in, ano lang na siya, based sa symptom, tapos blood work, ginalantaw lang if tas iya WBC sa iyang urinalysis, and then ginagaan siya sang drug. Sa akon ginadjutihan sa bang the usual drug that is given is clindamycin for UTI. So antibiotics and lifestyle changes. How to manage, of course, drink plenty of water, avoid acidic ones, coffee and alcohol, and use a heating pad if needed. Next one, this is the most important and I want you to remember it. E. coli associated diarrheal disease because this is the most common. We have the EPIC. First one is EPIC, enteropathogenic E. coli. This is the one that infects, or also known as infantile diarrhea, because it infects infants less than 2 years old. And its other name is the third world diarrhea. So again, our EPIC, enteropathogenic, known as infantile diarrhea, third world diarrhea. Enterotoxigenic E. coli, ETEC, Persilamite, that's traveler's diarrhea. Traveler's diarrhea. So it is obtained by, of course, those that are traveling due to the water, siguro, usually. Diarrhea in children less than 5 years. And the treatment or prevention is bismuth subsalicylate. So the ETEC, traveler's diarrhea, bismuth subsalicylate. Before, this kind of diarrhea is the deadliest one kuno. Sila sang cholera with the travelers. Kay mapatay, damo napatay because of this. Right now, we can manage it uh with the ORS or the oral rehydration salt. So may damo na treatment for the diarrhea. And then for the ETEC, we have the two enterotoxin, the heat labile and the heat stable. Heat labile, that means ma-destroy siya sang heat. ETEC produce a heat labile enterotoxin that is related to cholera. There is an activation of adenylyl cyclase to CAMP. Adenylyl cyclase is important in the production of ATP. There's intense prolonged hypersecretion of water and chlorides and inhibition of the reabsorption of sodium. So, inhibit ang reabsorption sa sodium, leading to depletion in our electrolyte balance. For heat stable na naman niya, heat stable enterotoxin, this one is more dangerous than heat labile because ang heat labile niya, pwede ka lang na mainit. For example, water, initon, mapatay na siya. Heat stable, on the other hand, there is an activation of guanylyl cyclates that stimulates fluid secretion. So ST, heat stable enterotoxin, produces the heat labile enterotoxin, leading to a more severe diarrhea. So may fluid secretion kag depletion sang electrolytes, leading to a more dangerous kind of diarrhea. So the antimicrobial prophylaxis is to increase uh Antimicrobial prophylaxis is effective, but it has the capacity for antibiotic resistance and hindi siya recommended. So, antibiotic treatment effectively shortens the duration of the disease only. It does not treat the disease, gina-shorten niya lang, gina-reduce niya lang ang time na mag-infect ang atan nga etek. So, the ways to avoid it is to really wash your hands, eat food that is hot and that is cooked, and then of course wash our raw produce with clean water and heat the water if ever you are um, doubtful of the source of the water. And that's also why, 'di ba, ang mga foreigners, those that are visiting the Philippines or visiting other countries, mas gasettle sila sa soda because they are not so sure of where the water came from, even though it is bottled water. That's why they settle on soda because soda, they know that the manufacturing and all of that nang nakasaho na sila. So the quality control and the quality assurance is good. And they are trusting that soda, Coke, Pepsi particularly, dila sila ga-trust. Next, we have our S-Tech, the Shiga toxin producing E. coli. So we have Shiga toxin 1 and Shiga-like toxin 2. It is more toxic than original Shiga toxin by Shigella dysenteriae. So the strain is 0157H7. Shiga toxin producing E. coli. Its symptoms is similar to Shigella dysenteriae, dysentery, vomiting, diarrhea, stomach cramps, and low-grade fever. So cooking thoroughly again and avoidance of unpasteurized products. Then we have our AIC, the enteroinvasive E. coli, similar to shigellosis, my bloody diarrhea with white blood cell. They are non-lactose fermenters or late lactose fermenters and are non-motile. So AIC is less common. And then the AEC, so cause acute and chronic diarrhea more than 14 days in duration, causes persistent diarrhea in patient with HIV. The AEC is usually ang i-target na niya si patient, immunocompromised patient. So, diagnosis by tissue culture adhesion, tissue culture adhesion lang. So, that's it. Enteroaggregative for those with immunocompromised patient. Enteroinvasive shigellosis, similar to shigellosis. Shiga, toxin, amuman, Shigella dysenteriae. And please remember the strain 0157H7. And then ETEC enterotoxigenic is known as traveler's diarrhea. Enteropathogenic is infantile diarrhea. Next one, we have the sepsis. Newborns may be highly susceptible to E. coli sepsis because they lack IgM antibodies. The strain naman sang E. coli causing sepsis is O25B-ST131. Please remember that. For meningitis, the toxin is the K1 antigen. It cross-reacts with the capsular polysaccharides of N meningitidis, causing meningitis. So E. coli works together with Neisseria to produce meningitis. Next one, we have Klebsiella pneumoniae. Klebsiella pneumoniae, extensive hemorrhagic necrotizing consolidation of the lung. Pneumoniae, din happen ang pneumonia sa lungs. So, Klebsiella pneumoniae attacks the lungs. You have two types, the pneumoniae ozanae and the rhinoscleromatis. So, rhinoscleroma, destructive granuloma and nose and pharynx, are naman niya progressive atrophy of mucous membrane ng aton ozanae. Then we have granulomatis, formerly known as Calimactobacterium granulomatis, causing genital ulcerative disease and known as the uncommon STD. For treatment for Klebsiella infection, we have ampicillin and tetracycline. Enterobacters belong to the escape pathogens and causes nosocomial infection, diseases, pneumonia, urinary tract infections, and wound and device infection. Resistant ang ating Enterobacter sa ampicillin, first and generation cephalosporins, and might be resistant to third generations as well. That's why for Enterobacters, we are giving carbapenems. Multi-drug resistant, including carbapenem class of antimicrobial agents, are given to those that are to our Enterobacters. Next, we have Serratia. As we joked it, Serratia. Serratia mercescens causes these diseases. Please remember that it forms red pigment known as prodigiosin, and treatment is third generation cephalosporin. Serratia, red pigment, prodigiosin. Proteus has swarming motility. So Proteus vulgaris has swarming motility, causing P. mirabilis causes UTI. So swarming, it looks like this, look spaghetti. Next, we have our Providentia here. The Providentia, Ritgeri, Alcalifaciens, and Stewarti are members of normal intestinal microbiota. They are the one that causes UTI. Providentia, remember Gundam Providence. Citrobacter causes UTI and sepsis. And meningitis in infants less than 2 months of age. And then we have the truly pathogenic gram-negative bacilli that we will be discussing in the last part of our video this week, okay? So stay tuned and move forward to the next video. See ya!